And good morning. Welcome back. We have Dr. Kelly McAlorney with us this morning. Good morning.
Morning. How are you today?
I'm great. Glad to have you on with us this morning. Kelly is Dr. McAlorney is with the Nash Breast Care Center. Tell us a little bit about the center and some of the services.
Okay, so we serve we serve multiple counties, and of course all the cities within in the area.
Yes.
And we're a full nationally accredited breast care center. So we do screening mammograms, which you can walk in and receive a screening mammogram.
Right.
You do not need an order
to
get a screening mammogram.
Great.
You can self-refer for that. We do diagnostic mammograms, which is when if you have your screening mammogram and they see something that's just a little out of the norm, or usually it's overlapping tissue, that's very common, then you'll have a diagnostic mammogram where we just take an extra view. And if you need it, then we also do breast ultrasound.
Now, do you have the 3D
We do 3D mammography. Every patient is allowed the opportunity for 3D mammography, which is a much better test, and we can get into that. But we do more than just those three things.
Okay.
We also do breast biopsies, which is where we test any kind of abnormality in the breast. We do it right there in the center. It's a quick procedure, and we send little pieces of any kind of abnormality to the pathologist who looks at it under the microscope and says, these are the type of cells in this area. So that's called a breast biopsy. And we also do localizations for if someone has to have a breast surgery and have to remove something, then we put a little device in that the surgeon can use to go right to that area. That allows the surgeon to take out much less tissue. So we do all of that, and we also do breast MRI.
Wow.
So it's the whole breast imaging gamut.
You just run the gamut.
Full service. We're a full service center. The other great thing about the Nash Breast Care Center is we work with 16 different agencies in the state. They're rural health centers, and we partner with them to help women who could otherwise not afford the services that we offer.
That's really good. Yes.
So we don't want anyone here.
Everyone should have an opportunity to have that done.
That's correct.
Everybody.
So we don't want anyone out there with financial difficulties to stop that from being, from coming to us for care. Because we can work with you. Wonderful.
Yeah. Well, Dr. McAlorney, I will be the first to admit, it's nerve-wracking to come in and have that mammogram. It's very
really
nerve-wracking. So can you just speak to that a little bit? It hurts, or I know y'all try to make it as easy as you can, but it's just nerve-wracking. So how do you relieve people's mind and put them at ease?
That it's going to be okay.
Yeah.
So that's a great question, and I wish one of my technologists were here. They're so wonderful at their jobs. And they're the ladies or gentlemen, but we only have ladies at this center who perform the mammogram. And with 3D mammography, they've really done a good job. We don't have to compress the breast as much as we used to for straight 2D mammography. It's called 3D. And we also have these beautiful little soft pads that we put onto the machine, and women report that is so much more comfortable. And we do have people every day say, wow, that is not, I thought it was going to hurt, it didn't hurt at all. A lot of people don't have any pain. Of course, breasts are tender. It's a part of the body that's going to have pain. Just walking around. So of course getting them compressed can be a little uncomfortable, but it's not anything that's overwhelming, and it's really about 8 seconds per breast. It's not even 8 seconds at once. It's just it's 2 seconds, and you do 2 different views. So that's 4 here, 4 here, and it's much better than some of the other screening tests that we have to do as we age. Those things we have to get checked. Other parts of the body have a much more complicated screening exam.
I agree.
So we really ask, we want people to not be afraid, and we're comfort first in our facility, and our ladies, our technologists are so good at their jobs, and they really make people feel comfortable.
And there's also not just the anticipation of having the test, but it's also the anticipation of what's the result going to be?
What's going to result?
I don't want to have it because I don't want to know, type thing. I've had women say that.
So that's another segue into an important discussion about this area of the country. Because you don't want to know the answer. could be, that could change the course of your life.
Yes.
So this is, I'm really glad you said that, because we're going to now talk about finding breast cancer. The key to survival, to mammograms saving lives, is finding cancers when they are small. That is the job of a mammogram. That's my job, to find them when they're small. If we find a breast cancer when it is small, the chance of the 5-year survival rate is nearly 100%.
Wow.
So it's not a death sentence. Now, the bigger a cancer gets before we find it, rapidly those chances of survival rapidly decline.
Wow.
So I'm going to throw out some numbers. We find a small cancer, 100% survival rate. A little bit bigger, the survival rate goes down to 83%. Oh. Look at that jump, 100% to 83%. Wow. We find it a little bit bigger, the 5-year survival goes to 72%. So we're 100, 83, 72. We find it when it's over 4 centimeters, 22% 5-year survival rate. That would be
stage
22%,
probably.
Stage 4. Stage 3 or 4. The stages are much more complicated.
And 2 are
Stage 1 and 2 are 93 to 100% survival rate, depending on whether it goes to the lymph nodes. But you don't want to be that person who, I don't want to know, and now my chances of survival have gone from 100% to 22%. That's a huge, huge gap, and we do save lives every day by finding tiny cancers. That's the whole point.
When you, after the mammogram, okay, let's say everything's fine. Do you just send a letter? How do you contact the patient?
People get a letter in the mail. If your imaging is normal, you'll get a letter in the mail. Say, see you next year. Have a great year.
And I'll tell you what, there is nothing, when you get that letter and you open it up and you think to yourself, okay, I haven't gotten a phone call. Okay?
Yeah.
I'm gonna open my letter carefully, pull it out. Let's go out to eat tonight. Let's party.
And we do celebrate that at our center every day.
It's that kind of a feeling, though.
Yes, it is.
It really is. And, you know, oh, I've got another year. Yeah.
Yes.
But then, okay, let's say I get a bad result. I haven't been getting my mammograms. I get a bad result. Okay,
so
let's go from
most of the time, if you get that call that says we need more imaging, most of the time it's going to be overlapping tissue. So, you know, the breast tissue stacks up. We always, in breast imaging, we always point to our own.
Yes.
It's on TV, but oh well, we're pointing to our own. So the breast tissue stacks up on a mammogram. And a lot of times, tissue can, can y'all see my hands? Like, let's see, can you see me? So it stacks up like this, but we really need to see all those little pieces in between.
Yes.
And occasionally you've got pieces that aren't going to spread out. So we bring you back and just spread it out a little bit more in that location, and we say, oh, there's nothing in there.
So it doesn't mean just because you call them and say, we need you to come back, and then everybody's, oh, God. It doesn't necessarily mean it's something. And it just means it wasn't quite as conclusive as you want.
That's right. And statistically, it's not going to be anything.
Okay.
Now, if you get a call back and there is a mass or an abnormality in the breast that leads to biopsy, is that where we want to talk about that now? So if there's a mass in there, first of all, we hope it's tiny, because if it's tiny, we do the biopsy where we send a few pieces to pathology, and they look at the cells. If it is a cancer, then you would go to surgery. You would see a surgeon and you would see an oncologist to talk about medical treatment. Depending on the size of it, you would go to a radiation oncologist to talk about radiation. That gets a little bit too far down the road, I think, for this discussion, but basically it's going to be removed.
Right.
And again, that's how we save lives. We find them when they're small and we get them out. And go to a surgeon and get it out. And then we see you back at the breast center in 6 months to a year and say everything looks good, it's out, you're good to go.
Wonderful.
And then you go back to your yearly screenings, or your yearly mammograms.
Right. Okay, you don't get a good result. Maybe it's stage 3 or 4. Do you have people on staff that help walk you through?
Yes, so we have nurse navigators.
You're not in a good way at that point.
That's right. That's a much scarier thing to go through. And we do have people to take care of all stages and to walk people through this whole journey.
Yes.
And we have nurse navigators. We have a great team. at Nash to help people get through this.
Okay.
But the stage 3 and stage 4, I mean, that goes back to don't be afraid to find out what, don't be afraid to come in, and let's make sure that if something is going to grow, we're going to snatch it out before it is large. And again, that's the 100% survival versus 22%.
Right.
Okay, so we want to just really make sure that listeners understand that big difference. Do not be afraid. We'll take good care of you.
Right.
Come on in and let us keep up with it every year. Yeah.
Okay, that is, well, that is very enlightening. And you know, with modern medicine now, I mean, there's no reason if we are proactive, that's the word. We have to be proactive, and you know, the key is prevention, prevention, prevention. That's before it becomes something.
That's correct.
So don't be afraid. You do not have to have an appointment. If you want to walk in, you can certainly do that at the Nash Breast Center, and I think that is key too. And it didn't used to be that way anywhere, I don't think. So I think
I'm
you're
not
realizing.
Sure about a walk-in. I'm not sure.
Okay.
Because I'm not at the front.
but you can call without a referral.
But you can call
without a referral.
Self-refer and make yourself your own appointment. That's right. Make yourself your own appointment. But if you want to talk about prevention, we can do that too.
Yes, let's do that.
So lifestyle. So there are genetic and lifestyle factors, of course, that change your risk factors for breast cancer. And in this area of North Carolina, this is the highest incidence of breast cancer in our state. And I think that there's a few factors. Number one is because women are not getting, well, the incidence is high, I believe, because of lifestyle factors here.
Right.
There's genetics involved, but lifestyle here, there's way more smokers in this area of North Carolina than in the rest of the state, twice as many. Wow. Okay, so smoking increases your risk of breast cancer.
Wow.
There's also more obesity in this region.
Yes.
So having too much body fat also increases your risk.
Okay.
Being inactive, that kind of thing. So I'm not sure what it is about this area that lends itself to that inactivity. But eating well, stopping smoking, taking that kind of good care of yourself.
Right.
Of course, that would decrease the risk of all cancers.
Right.
But there's also a lot of people don't realize that being out in the sun is very important. We need our vitamin D. We need to be out in the sun without slathering chemical sunscreens on and get that sun, get the vitamin D.
Right. So that, okay, vitamin D
is essential for all of our body systems. Lack of vitamin D, not getting the right amount, can cause most cancers and a lot of other types of diseases. So a lot of people didn't know. I mean, they'll slap on the chemical sunscreen and go out, but you need to get some sun without that. And you also need to have sunscreen that doesn't have chemicals in it after you've been out there for 30 minutes or whatever. You don't want to burn. Burns are what cause skin cancer. Tans do not cause skin cancer. It's the burns that people get over the years because they weren't careful. Or, you know, people do have skin that will, everybody has different skin, but you need that vitamin D from the sun. And then the other reason I think that we see, not that we see more cancers here, but we see more advanced cancers here as well. We see more, but we also see more advanced cancers. That's the stage 3 and 4 where the survival rate goes down. The reason we see more of those late stage cancers is because not enough women here are being screened. They're not showing up for their annual mammograms starting at age 40. And we've looked at those numbers and we've looked at those numbers, and only 1/3 of women age 40 and above are showing up for their annual mammograms in this area.
So 40 is the magic number
40 is the
to
magic
get started.
Number. For most people, there are some family risk factors that would have you come earlier, but it's 40. And that's a scary thing, though, that we're seeing so many more advanced cancers solely because they're not showing up for their mammograms starting at age 40. Because again, that goes back to find it when it's small. We got to find them when they're small.
Wow. So I want to ask you this, if you do have something, do you feel pain? Should you just go when you have pain to get it checked out?
Okay, so.
Because, or sometimes could you have it and not feel anything?
You can have it and not feel anything, and those are those small ones that we're talking about on the mammograms. People generally do not feel those.
Okay.
If you are feeling pain, pain in the whole breast is very common, and it's that's really not associated. That's not a breast cancer.
And you can have those fibroid, whatever you call it. What do you call them?
Yes, there's fibroadenomas. Those are very common. But if you have areas of focal pain in your breast, we should definitely check it out.
Okay.
There used to be misconception that breast cancer wasn't painful, that if you feel a lump and it hurts, it's not a breast cancer. That's not true at all. Any kind of lump that you feel, we should check it out. You should come give us a call, no matter your age, and no matter if you just had your mammogram.
And they should do self-exams too, to keep themselves checked. Is that right?
That's correct. Not in the traditional way that we used to talk about self-exams.
Oh, really?
What I usually tell people is choose your birthday. So if you're the 5th of, I'm February 5th.
Okay.
So the 5th of each month in the shower, I do my breast exam.
Okay.
But what we want to be careful of is we don't separate our fingers and just move around the breast with wiggly fingers. Okay. You want to have a solid wall of fingers, and you want to press firmly and stay in. Make sure that you're doing a pattern.
I can see that.
You want to be firm because normal fat lobules and things like that are going to stand out, and you're not going to really know what you're feeling if you've got wiggly fingers. So you're going to have a firm, and you're going to feel the breast with all 4 fingers together, or 3 if you have a short pinky like me.
Okay.
And you're going to be smooth and firm use shampoo or soap so that it glides, so that you're not getting stuck on skin.
This is great. You have been great. Wow.
Well, I care about it.
So much. Yeah, I know you do. I can tell you have a passion. Of course, that's why, and let's talk about that. Why did you choose this field?
Oh, that's a good question. I don't want to cry.
Yeah, I know. I get teared up too.
Both of my grandmothers, so my dad's mother and my mom's mother, had breast cancer, and my mom's mother fought a 13-year battle of serious illness with it. The treatments were very different back then.
Right.
She had metastatic breast cancer. It went all over her body, and she developed breast cancer the year I was born. So my first 13 years were spending a lot of time going back and forth to hospitals, chemotherapy. And I also saw how the physicians back then treated the patients. I mean, I was just in it for the first 13 years of my life. And I watched my mom lose her mother to it. So that's probably the factor. And then my dad's mother developed breast cancer. And she's a survivor. She had her breast removed, and it did not spread to anywhere else in her body, but I watched how she dealt with having one breast gone for most of her life and a very heavy prosthesis. I was very close to her and watched her go through that, so I think that's why. Those two.
Wow. That is a very good reason. Men can have breast cancer, can they not?
They can have breast cancer,
I mean,
yes.
Of course, the percentages are not as high.
They're not as high, but in this part of the state, it's the same as for women. There are more men in this part of the state than in the rest of the state that develop breast cancer. And again, it's the smoking and the lifestyle factors.
We eat so much fatty food here.
We do. And we need to not do that. Less sugar. Now, there's good fat and there's bad fat. We know, we've heard this, right? Avocados and all that. There's great fats that we need to be eating. Olive oil. We need fat.
Right.
And we'll be ill without it.
If I've got to eat an avocado, I'll just have to find a substitute. That is the one.
Olives.
I love fruits and vegetables. That's the one I cannot.
How about olives?
I love olives.
Olive oil, sesame oil, coconut.
And I cook with olive oil a lot.
Yes, that's very good. And and there's nothing wrong with a little bit of great butter and things like that. But it's the overeating of meat, red meats and things like that. And processed foods. And there is a lot about the fat, but honestly, fat is not what's making people obese and unhealthy as much as sugar and the processed foods.
Right.
So
that's right.
I know they talk about fatty foods, but I talk about sugar. It's decreasing the sugar intake and again, the processed foods where you don't really know what all is in there.
Right, that's exactly right. And I don't eat, you will not find anything, a frozen dinner or a frozen anything like that in my freezer.
That's great.
I just don't do that. But yeah, that's good advice. We need to watch what we eat.
Yes.
We really do. We are what we eat. I've heard that my whole life, and I believe we are.
So many of us like really good food.
Oh yeah, we do.
I think it's a time factor. People don't want to learn how to cook it quickly, and So
that's right.
Yeah.
We're all so busy. We work late. You know, everybody's in the hustle bustle, and I got to grab something quick. Let me get something out of the freezer, pop it in the microwave.
It doesn't even taste good, though.
No, it really doesn't. So thank you so much, Dr. McAloney. I enjoyed so much having you on. You are so informative. So we all learned a lot.
Don't stop. Come on in and see us.
That's
take care
right.
of your bodies, and we'll take good care of you.
At the Nash Breast Care Center, right there on the campus of Nash UNC Hospital. So anyway, we hope to have you back.
Thank you. This was fun.
Absolutely.
I really appreciate it.
We'll be right back, folks, with another segment on the Don Bullock Chevrolet Morning Show.
It was so great to have my cancer treatments right here in Rocky Mount, and the staff